spread of the disease. And policing in particular, they've embraced that. When I look at the work, and today I was speaking on a call to all police chiefs with Martin, we have regular daily operational calls, we can absolutely see the majority of police officers around the country are following the guidance really well. It is quite clear that, we've seen one or two incidences, and we shouldn't allow, a few social media posts to blow out of proportion the way in which the guidance are being put in place and enforced. At the end of the day, in our country, we have policing by consent, and that means our officers are engaging the public, they're explaining to the public why they shouldn't be having mass gatherings and congregating, while also encouraging them to act responsibly and do the right thing. And I think that is absolutely at the heart of the policing measures that we've been putting in place, and of course the relationship that we have in our own communities with our own police officers. Was there anything else you would like to come back on?
Thank you. Well, just Home Secretary, on the point about the negative impacts of the lockdown, were any of those, for example, the unemployment and levels of hunger and the domestic abuse that has been seen in homes, have any of those been worse than you expected?
Sorry, Ed, you just broke up there marginally. I think I caught your question. I think you just highlighted and said, were those measures worse than we had expected? Is that correct?
Were the negative impacts, like the levels of unemployment and so on, worse than you expected?
Well, I think, quite frankly, the measures that were brought in a few weeks ago now inevitably were going to have an economic consequence. And we are obviously going to work through that. And I think that's been highlighted very clearly, actually, by the work of the Chancellor and the Business Secretary in terms of the direct impact to the economy and the type of measures they have been able to institute to protect people and their livelihoods, which I think is really important. I do think, though, we have to recognise at the same time there's a whole spectrum of socio and economic impacts that will materialise over a period of time. We're in the process, and I don't know if Professor Powers would like to comment on this at all, but certainly working through SAGE, who will be collating this information and the data. And of course, they will be able to help inform us on policy decisions that we as a government and as politicians will be able to undertake going forward. But of course, our overriding concern will be the health and well-being of the public and the population, where there is deprivation and where there are serious issues of vulnerability. Those people are our priority. We have to find ways in which we can still access them, contact them, and look after them, whether that's at a local level or through some of the national schemes that we are putting in place. But of course, all of this going forward will rightly be based upon the evidence that comes from SAGE and the scientific advice that we'll be getting. Stephen.
So I think it's important to be honest, and I think we have been. There is no easy path, there is no easy course through a global pandemic. There are dangers whichever course you take, and some of those relate to economic consequences. I think the Chief Medical Officer has been very clear that from a health perspective, there are at least 4 things that we worry about in terms of the health of individuals within the UK. So the first is the direct consequences of deaths and harm through COVID-19. The second is that the health service gets overwhelmed by the number of patients, by the surge on it, and I'm pleased to say, as I said earlier, that has not happened, but clearly that is something that we worry about. The third is a reduction in access to health services because we've had to use a lot of our capacity for COVID-19, and I talked earlier about the need for people who have other health conditions, particularly emergency health conditions, to access the health service. And the fourth is the long